Schizophrenia. It will be coming as a 4 marker in our university examinations, and I have taken my points for this module from Manipal Exam Preparatory Manual for Medicine. So let's see what all you have to write if schizophrenia is as a 4 marker. First of all, you have to write the definition. What is schizophrenia? It is a psychotic disorder. Here the definition is somewhat lengthy, so I'll just split the points into different parts. First one you have to mention is it is a psychotic disorder. What is schizophrenia? Schizophrenia is a psychotic disorder, and that is characterized by hallucination, delusion, disorganized speech and behavior, flattened affect. What is this flattened affect? There are restricted range of emotions, that is flattened affect, cognitive deficits, occupational and social dysfunction. So these are the points that you have to mention while explaining the definition. Schizophrenia is a psychotic disorder that is characterized by hallucination, delusion, disorganized speech and behavior, flattened affect, cognitive deficits are there, and occupational and social dysfunction. And it is one of the most disabling and economically catastrophic disorder. Do you know why? Because of its lifelong course, debilitating symptoms, and lack of social acceptability. So here you have to mention two different things. One is a definition. What is the definition? It is a psychotic disorder that is characterized by hallucination, delusion, disorganized speech and behavior, flattened affect, cognitive deficits, and occupational and social dysfunction. And it is one of the most disabling and economically catastrophic disorder because of its lifelong course, debilitating symptoms, and lack of social acceptability. So let's see what are the etiology. The first and the most important one is genetic factors, because 50% concordance rate between the monozygotic twins are observed, and also 10% concurrence rate for the first degree relative. So there is a genetic predisposition for this schizophrenia. So genetic factors, 50% concordance rate between the monozygotic twins and 10% concurrence rate for the first degree relatives. And what are the environmental factors? The first one is genetic factors and the second one is environmental factors. What are they? Advanced paternal age, not maternal age, it is paternal age. Advanced paternal age, first and second trimester insult to the fetus, any anoxia, lack of nutrition, any trauma, etc. So first and second trimester insult to the fetal development, and then perinatal insult such as anoxia, birth trauma, etc. So environmental factors include advanced paternal age, first and second trimester insult to the fetal development, perinatal insult such as anoxia and birth trauma. So etiology, genetic factors, environmental factors. What are the other factors? Exposure to any psychoactive drugs during the adolescence or young adulthood. Any exposure to the psychoactive drugs in the adolescence or young adulthood. Any psychological stress like any adverse life events and highly emotional family environment, etc. And also structural abnormalities of the brain. The schizophrenic brains are smaller than normal brains with enlarged ventricles. That is a characteristic finding that we are seeing in the schizophrenia patients. So once again I will repeat the etiology. Genetic factors are there. Environmental factors, what are they? Advanced paternal age, first and second trimester insult to the fetal development, and perinatal insult. Coming to the any exposure to any psychoactive drugs during the adolescence or early adulthood, psychological stress, any adverse life events, and highly emotional family environment. Structural abnormalities of the brain, if we say, we are seeing in schizophrenic brains, they are very much smaller than compared to the normal brain with enlarged ventricles. And also it can be associated with temporal lobe epilepsy, Huntington's chorea, cerebral tumors, and demyelinating diseases. This is known as symptomatic schizophrenia. If the schizophrenia is associated with any other conditions such as temporal lobe epilepsy, Huntington's chorea, any cerebral tumors, and demyelinating diseases, it is known as symptomatic schizophrenia. So I guess this much is clear. So let's move on. What are the clinical features? While talking about the clinical features, there are two things that you have to keep in mind. There are positive symptoms, or it is also called first rank symptoms, and there are negative symptoms. While listening the name negative symptoms, don't think that it is not seen in this condition. This both positive symptoms and negative symptoms are found in schizophrenia. Then why it is called positive symptom and negative symptom? Because positive symptoms are the first rank symptoms and they are very important in diagnosis of the schizophrenia. That's why they are called positive or first rank symptoms. So let's see what are the positive or first rank symptoms. And these positive symptoms are synonymous with psychosis. And for remembering the positive symptoms, there is a mnemonic that is A, B, C, D. What is A? A for auditory hallucination, B for broadcasting, the insertion or withdrawal of thoughts, C for control of feelings, impulses, or act by others. D for delusion. I think it's easy to remember. Positive symptoms, or also they are called first rank symptoms. These positive symptoms of schizophrenia or the first rank symptoms of schizophrenia, this can be asked as a 2-marker separately also. So please keep this in mind. Mnemonic is A, B, C, D. A for auditory hallucination, B for broadcasting, C for control of feelings, impulses, or act by others, D for delusion. So I think it's clear. So let's see what are the negative symptoms. Negative symptoms include flattened affect, that is the loss of capacity to express one's feelings, resulting in a blank appearance, and apathy and loss of drive, social inattention, poverty of speech, poor self-care, etc., etc. So there are many symptoms in negative symptoms. Positive symptoms are only there are 4, A, B, C, D. In negative symptoms, flattened affect. There is loss of capacity to express one's own feelings, resulting in a blank appearance, apathy and loss of drive, social inattention, poverty of speech, and poor self-care. What are the other symptoms? Catatonia. What is this catatonia? Adoption of awkward posture for prolonged periods. The patient will be adopting an awkward posture and that will be for a prolonged period. So that is known as catatonia. That is other symptom. So positive symptoms we learned, negative symptoms we learned, and other symptoms only one is the catatonia. Now let's see what is the diagnostic criteria to say the patient is having schizophrenia. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5 criteria, that is used for the diagnosis of schizophrenia. DSM-5 criteria. What is the DSM-5? Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition. The patient must have experienced at least 2 of the following. According to the criteria, the patient must have experienced at least 2 of the following. What are they? Delusion, hallucination, disorganized speech, disorganized or catatonic behavior, or negative symptoms. These symptoms that we have explained in the definition part also, so it is easy to remember. Delusion, hallucination, disorganized speech, disorganized or catatonic behavior, negative symptoms. And at least one of the symptoms must be the presence of delusion, hallucination, or disorganized speech. So once again I repeat, according to the DSM-5 criteria, the patient must have experienced at least 2 of the following. What are they? Delusion, hallucination, disorganized speech, disorganized or catatonic behavior, negative symptoms. From this, at least one of the symptoms must be the presence of delusion, hallucination, or disorganized speech. There should be at least 2 of the following, but from these 2, the one should be from these 3. What are those? Delusion, hallucination, and disorganized speech. And one more thing, continuous signs of the disturbance must persist for at least 6 months, and during which the patient must experience at least 1 month of active symptoms. This is also important. So there are 3 important points in diagnostic criteria according to DSM-5. The patient must have experienced at least 2 of the following, and in these 2, one should be from these 3: delusion, hallucination, disorganized speech. And the duration is should be at least 6 months, and in these 6 months, 1 month active disease should be there with the active symptoms. And now let's see what are the management part. The management includes various modalities, antipsychotic agents we can use, psychological treatment we can use, and social treatment. And we have to use all these 3 concurrently. Then only we will get the effective treatment for this condition. So coming to the antipsychotic drugs, I will be making a video regarding the antipsychotic agents, the newer, the conventional and all, because that will be asked as a 2-marker question separately. So let's see what are the antipsychotic agents. Conventional are there and newer are there. What are the conventional antipsychotic agents? They are chlorpromazine and haloperidol. Newer include clozapine, olanzapine, risperidone. So conventional or first generation antipsychotics include chlorpromazine, haloperidol. Chlorpromazine, haloperidol. Newer, clozapine, olanzapine, risperidone, etc. Newer is also called as second generation. So let's see. So these are all about the antipsychotic agents. So let's see what are the psychological treatment that we can give. We can give general support for the patient, and cognitive behavior therapy may help the patient to cope up with their symptoms and also adhere to the treatment with the antipsychotic drugs. So antipsychotic drugs we have to give. Then we have to give the psychological treatment, support to the patient. We have to give the cognitive therapy. So this all will help in treating the condition with the antipsychotic drugs. The third one is social treatment. After the treatment of this disease, we have to rehabilitate the patient both socially and occupationally, so that he will be having a earning for his living. So that should be done. So these 3 things you have to write as the management part. So I think it's clear what all you have to write when schizophrenia is asked as a 4-marker question or 2-marker question. So I think it's clear. Schizophrenia definition you have to write, and then etiology, what are the etiology factors you have to write, and then you can write regarding the clinical features, both the positive and negative, and then you have to write the other features, only catatonia is there, and that's it. And then diagnostic criteria, DSM-5 criteria is used, and what is the criteria that I have mentioned. And then management include antipsychotic agents. Once you can write even the classification of antipsychotic agents if the time permits. That will give a good impression to the examiner, so that you can mention. Psychological treatment you can write, and social treatment. So that's it. It's a short simplified things about the schizophrenia. So